What I really enjoy about being an LMA or a medic at sea is the level of responsibility you get is really good. Pre-hospital care and primary care, and actually taking first aiders from a point of not knowing a lot about very much, seeing them treating patients just like you would see like an ambulance technician doing it.
Emergency landing, stand by for emergency landing. The helicopter has 10 minutes to land on. Hands to emergency stations, hands to emergency stations. Clear all compartments aft of Juliet section, removing DC equipment to the Junior Ace dining hall. Stand past CO2 extinguishers and CFHF to triple F drums. Establish personnel boundary at 2 Juliet hotel door. Attack party mustered from 1 goal passageway. Support party mustered from forward apartment here. Return party mustered from my workshop. First aid party mustered from
My job on board is to make sure that the ship's company have a focal point and someone to go to with regards to medical health care. That could be something as simple as a cold or a cough or, like I said, a sprained ankle, or it can be more emergency cases. So in any wartime situation or in peacetime situations where there's an emergency, you're going to need a bit of an insurance policy, and that is where the medic comes in. But it's not all up to me. I'm just one person in a team of 2 medics, myself and MA Shearer, and we also rely heavily on the chefs and stewards and training them in first aid. We train them up to a reasonable level so that they can support us in obtaining those objectives, and we have to be able to rely on their skills, because if there was an emergency with multiple casualties, we would struggle by ourselves to deal with up to a ship's company of 200, which is what we're dealing with at the moment.
Well, what we're doing, we're just currently looking at the way in which we can extract the patients from the aircraft safely. We're going to be using the C spine collar, and then we're going to be getting them onto the spinal board. And it's just about making sure that they've got the strength and depth to do this if they needed to by themselves. We've already had really good first aid from the flight, and that's something we train them in quite regularly. We'll have a look now.
Although I am the senior medical branch rating on board, I'm not the most senior person in medical charge, and we do employ a medical officer on board because of the area of operations we're in. It's really interesting that although we are quite isolated, we've still got a bit of support from a doctor, a fully qualified doctor, who can be there to back up our decision making or give us some knowledge and better our understanding of medicine with the information that you can only get from a medical degree. And that's pretty much what I do on a day-to-day basis. So it's a lot of management for me, and it's a lot of seeing people, making sure that they've got someone to go to when they need someone.